And I believe we are live. Welcome, George. How are you today?
I couldn't be better. Thanks, Stephanie. I'm glad to be again with you, talking about all things skin. It's a very important topic for me, and I immerse my life into skin, and any opportunity for me to talk to you in particular, I know we're going to have a fun time, and hopefully, a lot of your members will get to learn something from a little bit from us from this interaction.
And when you say we always have fun, we do, because when we start to brainstorm and talk about especially new technology, new ingredients, innovation, we get our groove on. And then I love talking to you, George, because you are so full of knowledge. Like anybody who's watching this, please stay tuned because what's in this incredible human's brain is something really intriguing to listen to as well. Today, we're talking about innovation in skincare. George, our industry is so innovative. It is so progressive. Over the past, especially 10 years, wow, what an explosion of new technologies and ingredients available. How do we even keep up?
Absolutely. I said that to myself as well. And look, I came from the other side, and the other side was the ethical pharmaceutical side of dermatology, the more conservative side of dermatology. And I thought that was quite innovative. We were treating, conditions like acne, severe acne, cystic acne, psoriasis, eczema, vitiligo, rosacea, and all those sorts of things. And I was having a good time, but I did make a career change and I started Dermocosmetica, and then I thought I'd come to the other side of the cosmeceutical area. Oh my God. Firstly, no one wears a white coat in this cosmetic space, like the dermatologists did in their old setting of dermatology. But there is more innovation here. There is things are changing every day. There are more and more companies that are looking at how they can further improve their products. Things are getting refined all the time. There is new companies and new products and new technologies popping up all the time. As you know, our consumers, our clients, but us as practitioners also are looking for the next best thing. And that's probably one of the things that there is so much pressure on everyone to improve, to get a better result, to raise the benchmark. And I see this only in Australia, honestly.
Really?
Yeah, absolutely. I'm very, very proud that we're part of this country that loves innovation and is always looking at that improvement. Maybe it's just something that we as Australians are, as we are with our sport and other things like that. That we're always in the lead, leading the way with having the best. I'm not necessarily saying that we are the best researchers or we find the molecules or commercialize these molecules, but we definitely are the ones that are using a lot more of these products and technologies than other countries in the world. Most definitely.
I have to say, now that you're talking about this, I recently, not even a year ago, had my trip to Europe as you do, and you look around because you're like, oh, I need some skin, I need some. Obviously, a couple of months with no skin treatments, you start to get itchy, and you're right. Here we have a plethora of clinics. We have so many incredible professionals, a lot in the medical space, the medical aesthetic space, whereas there's just not as much option in terms of practitioners there, I've found, and innovation in skincare. They tend to do the great work in the labs and then it all comes here, doesn't it?
It does, because we've got all these specialized people here. We've got people that are studying dermal sciences and beauty sciences and things like that, where a lot of the non-surgical treatments that are performed in Europe in particular are all done by healthcare professionals. So
Right.
whereas here we have all these skin qualified individuals that yeah, so we're very
Changing
lucky.
the game, really.
We-
And
we-
wait until I always say we've got one of the best, most incredible labs in the world. I think it's called, it's the CSIRO. We've got like an incredible research center. Once we start dipping our toe into research, Australians tend to be first with a lot of things. I mean, nobody knows we actually invented the or what do we invent? I think mobile technology, something like that. And I think once we dip our toe into that type of research, we will be one of the leaders as well. But for now, we are getting the best of the best from around the world and from Australia, and we're utilizing it. And your particular company is at the forefront of pushing that innovation. And I get excited when I talk to you because there's always something new. Tell us about what is the latest in ingredient technologies, what has been recognized in medical journals, because there's things that have the fad and the trend around it, and then there's things with clinical backed up science and data. Tell us a little bit about that.
Yeah, look, you make a really good point, and I think the thing that we all look for is science and data, and we look for the duration of and the longevity of and the usage of these technologies. So we're not looking for something that's just going to last for a year or popular for a year that you forget about. So I think one thing that has been great with us is that we've been able to identify technologies that have been current for quite a while and continue to be in the forefront. And I'd like to talk more about that, of course, today, but as I mentioned before, I moved away from the traditional dermatology space, or being in that, dermatology space, where a lot of the practitioners were using, topical antibiotics, steroids, lots of those sorts of things for, vitamin A's, etc. But now we've come into this cosmetic space. It's another world, right? We're talking about millions of literally millions of ingredients that we need to know about, because the skin is so complicated. It's all about receptors and metabolic pathways. Whereas in dermatology, in the traditional sense, we're only thinking about one or two ingredients, maybe three at max. And now, you pick up a skincare product, and there's a whole list of ingredients down the back here, and you've got to know about them. And so there's a lot of innovation from how we formulate things, and how they act on the body. And so I guess I all started by coming into this industry to try and offer something different. With my experience, I know that most anti-aging companies or brands have your typical A, B, C, D, E, sort of like ingredients, etc. And I thought, well, I'm not going to cut it if I'm just going to bring another vitamin A or just another vitamin C, etc. And I thought, with my medical background and pharmaceutical background, I thought I'm going to bring some medicalization into cosmeceuticals. And what that meant was I went out there looking for, and it took me, by the way, 5 years or 6 years to really find these products. So it wasn't just an overnight thing to bring these products. And I wanted to make sure that number one, that we had some very good formulations. They were very current, they were refined, they were updated every year. I wanted to make sure that the ingredients that were used in the products that we sourced were supported by the medical evidence. So, were they used, was it supported in acne or rosacea or sensitive skin, or as a post-treatment product or as an anti-acne product? The third one was, which we're probably going to talk more about, is the innovative ingredient technologies. And this is where I get excited about, and I get goosebumps every time
Me too.
I talk about some of the things that we've been able to introduce into Australia and New Zealand in particular. Has been, these unique ingredient technologies where we talk about these terms called growth factors, stem cell activators, DNA repair enzymes, MEP technology, to treat women, or to treat the side effects of menopause in women going through that bad stage of their life of perimenopause or menopause. So they're just like some of those ingredient technologies. But it's also, taking, old ingredients like vitamin A and going, how can I further improve this amazing ingredient that's been used, in nearly every part of dermatology? And how can I get it more get it more effective? How can I make a cosmeceutical, as effective as a prescription grade product? Or how can I make it more tolerated? How can I make it more bioavailable? Etc. And so we've managed to identify and partner and with companies around the world that treat their cosmeceuticals like medical products, or as medical products. And I like that, because that, to me, that means that my philosophy, my ethos, and everything that I stand for, the seriousness of what I stand for in making sure that we're treating things properly and we're not just adding a moisturizer to our skin, follows through from my days, my 30 plus years in the pharmaceutical industry.
What you just said, I remember you so graciously had me as a guest in your premises. And what I remember is going into your warehouse and thinking, am I in a clinical lab space everywhere? Even when you, like how you stock your products was so immaculately clean. And I'm not saying that, others aren't, but yours was beyond. I've never seen anything so organized and so immaculate. You could literally formulate right in your stockroom. And I said to you, wow, what's the reasoning to keep it so clean? And you said to me, well, I deal with medical products here. Of course, I'm going to have it almost sterilely clean. And I walked away thinking, wow, that's goals.
Yeah. Yeah, look,
I would trust your products. There's so the way that you deal with them has that leftover incredible medical philosophy surrounding the research in you.
No, we're very proud of what we do, and we do take our field, our time here very, very seriously. We owe it to ourselves, but more importantly, we owe it to our customers. Our customers put a lot of faith in us. We're here in trying to build some long-lasting relationships, which are based around some strong foundations, and those foundations are about trust. And trust doesn't come only because we're a great and nice company to deal with. We are that. We have got a good name, I hope, in the industry. But it comes from these carefully, scientifically curated products with these leading edge technologies that actually give that effectiveness, that efficacy that people are looking for when they're treating their clients, and they're getting the results, more or less. I mean, they're results, and if you're getting results with your clients, then we build a good trusting relationship. So every time that we've introduced a new product or a new brand, a lot of our customers will take on our second and third and fourth brands as well. They don't think about it because they know how careful we are and how we go about selecting.
I would say meticulous in everything from A to Z. Like I've noticed from your ingredient technology that you have, through to your training, through to your you know, your whole system of working with your company from start to finish is just it's an immaculate process. And that's why I think, you know, you can really trust a company when they've got so much attention to detail, and especially in that picking those ingredient technologies. You talked about vitamin A, sourcing vitamin A, and of course we're very fortunate in Australia because we don't have restrictions. We always have the 1% restriction in our formulations, but obviously in the EU now they're repealing the vitamin A. Well, the dosage of it is very drastically reduced. That's forcing everyone in the EU to be smarter with their technology. The delivery systems are becoming better and more sophisticated, using less retinol in a more potent way. And you're sourcing these right from the source of that leading technology. But we are very fortunate in Australia. We're still able to use that higher dose, right?
Yeah, absolutely. And look, we've got one here, which is called Retroderm, and this is an amazing
Yeah.
product. It's the only aqueous retinol in the market. It's a pure retinol, aqueous suspension. So everything more or less comes in other forms of vitamin A, like in creams, which are liposomally delivered. But it's been found that the aqueous suspension and this unique patented delivery system, the innovation, the vehicle, allows the pure retinol to be made a lot more bioavailable in the skin, and therefore the conversion from retinol to retinoic acid or tretinoin is a lot faster, but also a lot more complete. And therefore, I guess in the biochemical studies has shown to be as effective as a tretinoin cream. So this is the innovation: is that a beauty consultant, a skin therapist, a dermal clinician doesn't necessarily need a doctor to prescribe a well tolerated but a very effective vitamin A product. I remember seeing Dr. Adam Sheridan, a dermatologist in many ponds, when I first introduced the product, and he said, "George, I don't believe you. That these cosmeceuticals actually work." And I said, "Look, I felt the same." I said, "Look, just try it. Just here are some products to use with your clients." And I came back with the person that formulated this product from the US, and we visited him. And the first thing he said, he didn't even say hello, anything like that. He said, "This is the real deal." He said, "George,
Wow.
this is the real deal." And they're the sort of comments that we get with a lot of our products. But yeah, so on vitamin A, look, everyone's got to use vitamin A, and I'm pleased that we've got a formulation that stands out.
Well, the aqueous suspension's got me curious. So is it encapsulated? Is that how it sits in the
Yeah, there's a unique patented system. I won't go into the details with that, but it is delivered a lot easier into the skin. So, and it's all, as you know, it's all about absorption. It doesn't matter how expensive the product is or what the concentration is. If you can get that penetration, it's all about penetration.
Yeah.
If you get the penetration, then it punches above its weight.
Oh, absolutely.
And
When you
then
say punches above its weight, it's exactly right. You don't need a mega dose if it's delivered in the right way, right?
correct. And then if you can combine it with other humectants or moisturizing sort of ingredients to at the same time, retain the authenticity of this pure retinol, well then, you've got something which will be a lot more patient accepted because of its galenic formulation, less sensitivity, less dryness, less itchiness, all that sorts of things.
Got some really innovative brands in your stable. What do you think sets ingredient technologies apart? Because there's so many. You said there are millions, literally millions out there. And, as a consumer, okay, let's put it as a consumer point of view. You're looking at an ingredient list and you don't know what's going on. You're seeing the INCI list and it's just names. You don't know how to decipher. You're a therapist, your ingredients a little bit better, but even staring at an INCI list if you're a therapist, can be overwhelming. How do you decipher what is?
Yeah, look, that's a very important point. I think one of the benefits I had when I worked in the pharmaceutical industry was I spent a lot of time working with pharmacists and also working with people in the medical department and the scientific affairs department of these companies. And you know, we had to know everything about the pharmacokinetics, the physiology of the person, and how it all behaved and worked. And the ingredient was just one way. And so when I go around looking for products, I look at, okay, so we need to have, you know, A, B, C's, D's, and E's, fine. But I don't spend that much time looking at that. I actually spend more time looking at the technologies, because we need to improve. As I mentioned before, you know, how do we improve the benchmarks? How do we improve you know, how do we get better skin quality by using these sorts of vitamin A's or these sorts of other things? How do we conquer and manage pigmentation better? You know, with new technologies, and so I focus more on that and make sure that there's lots of clinical studies behind those technologies. So, for example, I'll talk to you about one specifically, which is a growth factor. We know growth factors are occurring in our body as we age. You know, they diminish, and their purpose in life is really to help us with the reparative process of, you know, aging skin or damaged skin, etc. And so these growth factors that we've got, which are an animal growth factor coming from a very specific type of snail, the Cryptomphalus aspersa. There's 650,000 of these beautiful snails in the north of Spain, in Santander, which are looked after like kings and queens, and
Wow.
are caressed and stimulated in a very patented but an approved way, where there is no harm on the animal.
Oh
And
no, they're in Lux Spa World.
correct.
Stress-free spa world.
Exactly. And they produce a specific type of protein, which is a little bit different to that snail protein or to the liquid protein, or that the snail trail that they produce when they walk down your driveway, if you like. Yeah, it's so much different. But you know, we're talking about a technology that was, you know, identified in during the Chernobyl disaster, and now continues to be as strong as what it was then. And you know, we're talking about with this product in particular, which or the growth factor, which we use in our range called the Biopal 10 SARS range. That there must be close to around about 25 to 30 published studies on the product, but also on the technology. So that for a cosmeceutical, it is quite unheard of. We're talking about being published in a reputable journal. It's not a white paper. It's not a scientific paper. It's not a case study. It is a peer-reviewed, independent, you know, journal articles, you know, either from the US or from Europe, etc. And research continues on. So, and you know, going back to, but why and how did you find these companies, and why do these companies do it and others don't do it? Well, again, I wanted to find the companies that followed that pharmaceutical ethos, that saw their products as, you know, obviously very important, and especially when we're treating skin conditions. But many companies don't invest over $150,000 to do a trial. And, you know, the cost of doing a trial, a proper trial, is, you know, can be with small numbers, say up to about 20 patients could cost anywhere up to $150,000
Absolutely. And beyond.
and beyond. But, we're talking about this continuation and,
Wow.
so, that's why we've carefully teamed up with the two largest dermatology companies in Spain, one of the largest companies in the US, the most innovative company in Italy, IPSA,
Mm.
and of course, now the emerging, uh, big company that we've been working for 13 years now, Dermoceutic, is because science is everything for them. It's everything for them. Yeah, look, I don't have my own skincare range. I should. Everyone tells me, George, you should produce your own. And I'm going, I'm not an expert in
Right.
putting skincare ingredient technologies together. I'll leave that up to the experts. I'll leave it up to the people that have got the resources that actually can update and improve every 2 or 3 years.
Yes.
I don't have that facility or that ability. What I can do very well is actually commercialize. I can train. I can put a team together that can go out and actually inspire clinicians to use these technologies. But I'll leave the expertise on the science to the experts. And also, I guess the other thing that we do is that we can talk more about that story because we do understand the science and the technology. So we've been in that space. Our background is medicine, dermatology, etc. And that's what we try and do.
I think allowing, not having your own product range, but sourcing the absolute best of the best from around the world allows you to focus on what you do, which is, not be partisan like to one brand, but really seek results and truth first. And that is one thing that is very unique with regards to your particular operation and your particular company, is that you will pull out the product that is the best for that particular thing and say, this is what I recommend, or this is what we put what we back. And when you were talking about BioPel Tensage, I was thinking to myself, my gosh, that is one product I've always wanted to try. That is something that is leading and using this technology that was so incredible around that time where, that disaster happened. And then finding other ways to utilize that, and then it's seeping down into the skincare world. It's a wonderful story in itself. But when you said Tensage, one thing that we, and as women and men, obviously all around the world, we're always looking at the tensile strength of our skin. We see it as skin laxity as we age, lose weight, gain weight, so forth. It is still the big eluder of skincare science, is how to get things back where they were before. We're starting to breach that gap. We're at the cusp of starting to find out how to really address skin laxity concerns. And you have so many incredible ingredients and technologies out there that you stock, in particular, some we can and some we can't talk about today. But where do you think that area is going to go in the next 5 to 10 years? Do you think that we will get to the point where we are able to then change really dramatically the trajectory of the tensile strength of our skin?
Yeah, and that's a very, very good question. And look, I guess, in my crystal ball, I think, how are we going to go? I don't know, but I'm pretty positive that we're starting to see some of those improvements in that area. I think we're all excited about the ingredient technologies, the new technologies that are coming through. Some that we have and some that we don't have. They're all sort of like making a really good place and upping the bar. And we've got topicals, of course, but there's also the injectable space. So which are all going hand in hand. So there's a larger focus now, even in plastic surgery practices, with plastic surgeons that I talk about. Their focus a lot on non-surgical techniques or non-surgical treatments. And, that involves, injectables. It could be now using the hybrid cooperative complexes, that brand that we promote, which is a hybrid of high and low molecular weight HA, which is injected into a certain part of your extracellular matrix that through different receptors, produces all that magic with producing 4 different types of collagen, elastin, and also stimulating that fat. So that's really amazing technology. Now, when you then build that up with other technologies, like if we go to our technology, which is called MEP technology, which is methyl estradiol propanoate, sounds like a long word. It is long. For menopause, this non-hormonal treatment actually complements that hybrid cooperative complex, the injectable that we said, by actually stimulating receptors, estrogen receptors that have gone to sleep.
Yes.
So even, ladies that are in there, maybe in their 60s or 70s, will have these receptors be activated and produce collagen. And, will help anyone who's, that sort of typical patient or client that you have that's is in their, mid 40s, and they're suffering that elastosis, that skin laxity. It's starting to lose that definition. Since the skin is becoming a lot more sensitive, it's a lot more frail, it's losing that lackluster, collagen loss, etc. Yeah, we've got now technologies that and products that you can use to fight all that. So I guess the point is, ask for the research. If it's a good product, the manufacturer, the supplier will have done their research. They would have done their investigatory trials and studies. They would have done biopsy studies. They would have done lots of different studies to look at the percentage increases in collagen, the types of collagen, the elastin, even down to the point of the effect of, on fat cells, the effect on muscle, the effect on bone, etc. So I think that's where we're all going. I think we're all moving towards anti-aging, but it's the term actually is not anti-aging. Well, it is anti-aging, but I think if I can, the future, what you're talking about is regenerative medicine.
Yes.
And that's how I think
longevity medicine.
yes, and that's where I think we should be looking at the skincare products that we select, the injectable products that we select, or the energy-based devices that we select. We should be looking at how do these products fare in that regenerative effect on the skin. It's because it's all about regeneration, and that's the buzzword. And we're very glad that through our skincare technologies and our injectables that we've launched and are also launching more next year, is all about regeneration.
I can never wait to see what you've got cooking in the background. I'm always so curious. So you've got more products even coming next year. I'm completely obsessed.
Early next year.
Wow, I'm completely obsessed with your products. There's some that I use religiously. Obviously, I wish you could put everything on your face all at once. But it was so funny when before we went on the live, you were showing me your products and I was showing you back your products. I'm like, this is your product, literally. And the reason I say that is because, I'm a formulating chemist. I know my stuff too, right? And I'm obsessed with skincare. I'm obsessed with ingredients. I try so much stuff. George, you have no idea. But honestly, when I was before this live, when I came on, I'm like, you need to get me more of this because I'm obsessed to the point of like complete obsession. Isdin, you were talking about it's a Spanish brand, did you say?
It is. It comes from
I have to plug
the,
this.
the largest dermatology company in Spain. And here's a shout out to all our Spanish friends that may have some relatives that are going through a bit of a difficult time with all those floods and the disasters down there. But look, just an amazing skincare brand. But they represent a lot of what is dispensed in pharmacy and dermatology and prescribed. And they have the most popular sunscreen range called Isdin Sun. And the reason why we also partnered with them is that we're actually developing together with them. We're developing formulations and products that will be launched or hopefully registered and launched in Australia. So we have the most popular sunscreen in Europe, or the company that makes the most popular sunscreen in Europe, partnering with us in Australia to develop a specifically a sunscreen range specifically for Australian skin.
Oh, wow, that is huge.
It is huge. We're excited because as you know, we always want to be in the forefront, with the best, bringing the best to Australia. And because we know that there are so many limitations to registering products in Australia
Yeah, and
with
there's changes to the
sunscreens.
TGA. Lots of people don't know, but people are having to rejig all of their formulas for sunscreen. It's a minefield.
It is, and we want to bring, the best, and we feel that we've partnered with the best company possible to do that. So watch this space.
I'm so excited.
Yeah, so there's
Yeah,
more
I'm
innovation
really
coming that way.
well done. Well done to you, George. And, as I said, it takes a lot for me to say, wow, one of the best products I've used, and I back that. I love everything you've got to say. Please come back and tell us more about what you're doing in the future, and and how we can learn more about these incredible science-based, evidence-based products. And thank you so much as well for being an incredible supporter of our industry. You are such a diligent, responsible, generous company, and yourself as well, because you don't just look at the commercial aspect of it. You really care about, I'm a clinic of yours as well, so I'm a stockist of yours. But apart from that, like, because knowing firsthand how I am treated through your company, but you can go beyond that and go, how else besides commercially can I help the industry? And supporting ABIC and other industry bodies, you are the first one to say, how can I help? What can I give you? What you do is subsidizes literally the support that we give our clinics, our HR support, our facilitation, and our work with government. So thank you so much for being a proud foundation member of ABIC. We really appreciate it.
No, thank you. Thank you for your time today. But I truly believe in you and the people that you represent. Our company would not be where we are today if I wasn't inspired by people like you and your members. Um, this is the driving force for me, that I get out of bed, provide the best products, and look for the best products in the industry, because I feel that if I can make a difference to you and everyone else's life, then we're all making a little bit of a difference here in this world. Yeah, so I feel very honoured to be part of this, part of ABIC. I am there for you and also for everyone else that you represent. Yeah, I really appreciate it, and it's for me, it's more than just sort of like having commercial success. I think we're at a stage now where we are ready and we would like to give back as much as we can. So we're here to give you and everyone else the support that we can.
Thank you. And you do in spades, and our members in the industry, thank you so much for it, because we've come so far. We've actually done incredible work over the last 3 years. Things like we have now recognized cosmetic nursing as a profession. literally as an occupation. So that's getting put out, you know, in the next census. You'll be able to tick cosmetic nurse when you couldn't before. You'll be able to tick dermal therapist and dermal clinician and beauty therapist under the right qualification terms. You know, we're starting to change education. We're looking at self-regulation and doing a lot of work in that space. We're changing the trajectory and the viewpoint and standing within of our industry and making it more respected, and that's what it's all about. So thank you. And thank you everyone for watching. It was an awesome live.